Welcome to PKR Vibes Career and Growth. Today we are discussing about the basic topic in a healthcare. The topic name is three pieces in a healthcare. The three pieces are patient, provider, payer. We have to discuss individually what is what. The first one is patient. A person who receives the medical treatment from the doctor is known as a patient. The next one is provider. A person who provides the medical treatment to the patient is known as a provider, is also known as a doctor. Generally, we have a two type of providers. The first one is referring provider. The doctor who is visited by the patient first is known as a referring provider. The referring provider, also known as a PCP, gatekeeper, or family doctor. Generally, he gives an approval to the patient to consult the specialist. The next one is rendering provider. A doctor who has more advanced medical training is known as a rendering provider, is also known as a specialist. And the last one third one is payer. Payer is also known as an insurance or carrier. A company who pays the medical treatment to the doctor or pay to the patient is known as a payer. So payer is also known as an insurance, right? In insurance, we have a two type of insurances again. The first one is medical insurance and next one is liability insurance. First, we have to discuss about that medical insurance. In medical insurance, again we have a two type of categories. The first one is federal insurance and the again next one is private insurance in medical insurance. The first we have to discuss about the federal insurance. The federal insurance is nothing but which is based on government rules, like the federal insurance. The trust is a based, trust is a matter, the profit or loss is a secondary thing. So the example for the federal insurances are Medicare, Medicaid, Railroad Medicare, Tricare. Tricare is which is related to military, that is who fight for land. Champas. Champas here as US means it is stands for Uniformed Services. Here Champas is related to Navy, Army, Air Forces in that way. Champ VA. Here VA stands for Veterans Affairs. Champ VA is related to retired civilian people. The next one is private insurance in medical insurance. The private insurance is clearly based on profit level. So there is a trust is very less in this private insurance, but the profit is clearly more in private insurance. In private insurance, there again we have a individual plans and group health plans. In individual plans, we have a like advantage plans, HMO, PPO, POS, EPO, that kind plans comes into the individual plans. Group health plans is a in a group way we have a health plan, not like individual. So coming to the liability insurance. In liability insurances, we have like workers' compensation, auto insurance, no fault insurance. The workers' compensation is generally which is for at office premises on business hours. The persons who are working in offices, they are covered for workers' compensation. Auto insurance is like generally which is related to road accidents. Who met accidents suddenly while driving, so that cases will comes to the auto insurances. The insurance, the particular insurance is there, that is called as a auto accident insurance. The third one is no fault. So in the name itself we have that no fault. No fault means, for example, if you did an accident to your friend, your insurance plan will cover him. That is no fault insurance. So like we have medical insurances and liability insurances in insurances types. Thank you for your time.